Hello everyone, my name is Olivia Pence and my field of study is health sciences, specifically the dental field. Access to dental care is a crucial component for overall health and well-being. However, in many areas across the United States, including regions like Utica, New York, access to dental care remains a significant challenge. Today I will be exploring the issue of limited access to dental care in areas, examining the causes, consequences, and potential solutions to this unfortunate problem. One of the main causes of limited access to dental care in areas is a shortage of dental professionals. Specific regions like Utica, New York struggle to attract and retain dentists due to factors such as lower population density, limited economic opportunities, and professional isolation. As a result, many communities have an uneven, low number of dental professionals, leading to longer wait times for appointments and reduced access to essential dental services. Another contributing factor is the economic disparity between urban and rural areas. Rural populations tend to have lower incomes and higher rates of poverty, which can make it difficult for individuals to afford dental care. Additionally, many rural residents lack dental insurance, further worsening the financial barriers to accessing dental services. The cost of dental care, including preventative treatments, restorative procedures, and orthodontics, can be excessively expensive for those without adequate insurance coverage. Geographic isolation also plays a significant role in limited access to dental care in rural areas. Rural communities are often located far from urban centers where dental clinics and specialists are concentrated. This geographic distance can make it challenging for residents to travel to dentist appointments, especially for those without reliable transportation. There is a form of transportation called the Medicaid cab. However, I don't find it a good resource because from my patients' experiences, they tend to not show up on time or not show up at all. The lack of public transportation options in rural areas further compounds this issue, leaving many individuals without practical means of accessing dental care. The consequences of limited access to dental care in rural areas are far-reaching and impact both individual and community health. One of the most immediate effects is the deterioration of oral health amongst rural populations. Without regular dental checkups and preventative care, individuals are more likely to develop dental problems such as cavities, gum disease, and tooth decay. These conditions can lead to pain, infection, and tooth loss, significantly affecting a person's quality of life. Furthermore, poor oral health is closely linked to other systematic issues. Dental disease is known as the silent killer because a patient may not experience any symptoms that can be a contributor to other health-related diseases. Research has shown that untreated dental problems can contribute to serious health conditions such as cardiovascular disease, diabetes, and respiratory infections. For example, gum disease has been associated with an increased risk of heart disease, while untreated dental infections can lead to complications in individuals with diabetes. Therefore, the lack of access to dental care in rural areas not only impacts oral health, but also poses a broader threat to overall health and well-being. In addition to health consequences, limited access to dental care can have a social and economic implications. Poor oral health can affect individuals' ability to find and maintain employment, as dental problems can lead to difficulty speaking, eating, and maintaining professional appearance. This, in turn, can sustain the cycle of poverty and economic disadvantage in rural communities. Moreover, untreated dental issues can result in higher healthcare costs in the long run, and emergency dental visits and advanced treatments become necessary. Addressing the issue of limited access to dental care in rural areas requires a multifacial approach that involves collaboration between policymakers, healthcare providers, and community organizations. One potential solution is to increase the number of dental professionals in rural areas through targeted recruitment and retention programs. Rewards such as loan repayment programs, scholarships, and financial bonuses can encourage dental students and practitioners to work in underserved rural communities. Someone who is just graduating dental school may pick an area with a high population density of professionals because their pay rate would be higher. However, if these rewards were offered, it would give low population density areas more opportunities for professionals. Additionally, expanding opportunities for dental hygienists and dental therapists to provide care can help alleviate the shortage of dental professionals. Teledentistry is another promising solution that can help close the gap in access to dental care. By leveraging technology, teledentistry allows dental professionals to provide consultations, diagnosis, and treatment plans remotely. This can be particularly beneficial for rural residents who face geographic barriers to accessing dental care. Teledentistry can also facilitate collaboration between rural dentists and specialists in urban centers, ensuring that patients receive comprehensive and timely care. Community-based initiatives can also play a crucial role in improving access to dental care in rural areas. Mobile dental clinics and outreach programs can bring dental services directly to underserved communities, reducing the need for residents to travel long distances for care. These initiatives can provide preventative service, education, and basic treatments, helping to address immediate dental needs and promote long-term oral health. Policy changes in state and federal levels can further support efforts to improve access to dental care in rural areas. Expanding Medicaid coverage to include comprehensive dental services for adults can help reduce financial barriers to care. Additionally, increasing funding for dental public health programs and community health centers can enhance the availability of dental services in rural regions. Policymakers can also explore innovative models of care delivery, such as integrating dental services into primary care settings to ensure that dental care is accessible and coordinated with other healthcare services. From my personal experience working in a dental office in New Hartford, New York, running a dental practice in this area has been both challenging and rewarding. One of the biggest issues we have faced is the lack of availability of dental hygienists. For the past 2 years, we haven't had a hygienist due to the limited number of graduates from local schools and the high demand for their skills. This shortage has significantly impacted our ability to provide timely care to our patients. However, despite these challenges, our office stands out in the community because we accept all insurances and welcome new patients. This is something that few other practices in Utica offer, and it makes us a crucial resource for many families in and out of the area. However, the high demand in our services had led us to longer wait times and the need to book procedures and preventative care months in advance. This can be frustrating for patients who are in pain and require urgent dental care. Another significant issue that we face is insurance denials and partial coverage for dental treatments. Many insurance plans only cover half of the treatment costs, leaving patients with substantial out-of-pocket expenses. This financial burden often leads patients to delay necessary treatments, which can worsen their dental health overall. It's a persistent problem that highlights the need for better insurance coverage and more affordable dental care options for everyone. While our practice and many other practices are dedicated to serving the community by accepting insurance and new patients, the lack of hygienists, long wait times, and inadequate insurance coverage presents ongoing challenges. We remain committed to finding solutions and providing the best possible care to our patients. The dental field faces numerous challenges that require immediate attention and innovative solutions. From the rising cost of dental care to the disparities in access and need for advancements in technology, these issues impact both practitioners and patients. Addressing these concerns through policy reforms, increased funding and research, and a focus on preventative care can lead to more equitable and efficient dental healthcare system. By working collaboratively, stakeholders in the dental field can ensure that quality dental care is accessible to all, ultimately improving overall public health and well-being.